Today was absolutely insane. I cannot believe it. So stoked to tell you guys all about it. OT Life Hacker here, by the way. Okay, so today in the acute care, as I am an occupational therapy student doing my Fieldwork Level II, and so that means I get to see patients much more hands-on. In fact, I'm seeing patients independently, but of course checking in with the occupational therapist if I need, and he checks in on me. I got to see patients in the isolation unit, you know, with the current illness going on. People who have the current illness are on that unit, and I got to be there to work with one of the patients. And there's also patients who have an antibiotic resistant infection, which means that drugs used to treat their infection, the bacteria might be killing the drug, and so it actually defeats the drug and continues to grow. So treatments may not work for this condition. And the one that I saw was staph, if anyone knows what that is, the easier to understand term for it. Yep, so the craziest part of the day was witnessing during my therapy session. Fortunately, the therapist, my supervisor, was there. I got to see and even felt, essentially saved him from falling, because the patient sat edge of bed, and all of a sudden he was trying to use the catheter, he was trying to use the urinal, which is a kind of like a container, a cup that you can urinate in if you're not able to go to the bathroom or for other reasons. So he was using the urinal and was sitting at the edge of the bed, and all of a sudden his head fell back, his body completely fell back, completely unanticipated. He was perfectly fine, well-oriented, meaning he was conversing with us, he knew what was going on, but all of a sudden he essentially lost consciousness and fell back, and the urinal had fallen to the ground, and we caught him in time. When we got him back up, he was unresponsive, he had a blank stare, and he was very limp. He was unable to move his arms, and so we lowered him back to the bed, put him back in lying down position, and he was still unresponsive, but a little bit more. So he could mutter some answers, but they weren't totally relevant to what we were asking, but he could respond or say something. So he had some sort of alertness. And fortunately, the nurse had come in, his nurse, and because the nurse had heard the urinal drop on the floor, so he came in, and the nurse had thought, and even we were discussing what the possibilities were. Maybe it could have been a hypotension, but given this person's case, the reason why they came in was based on what we saw and what we read and what the patient was telling us. It was the reason they came in was what we witnessed, because they had fallen due to having essentially losing consciousness and falling. So it was absolutely insane to witness this, but I learned from this that if an acute event like this happens, where your person falls or loses consciousness while you're working with them, or like in the case for this person, or in the case of this person, the nurse and the medical team, they suspected that maybe he was having another seizure or even a stroke, or he had, like I said, hypotension, or there's a lot of different reasons. And so the three things that is best for us as a therapist or the people working with him, if this happens, the three things are: make sure he's safe, and so that's why we had returned him to the bed. We had first brought him back up to the sitting position to see if it would go away. It did not, so then we lied him back down on the bed. And then 2, call the nurse or call anyone that you can to report, because what if it is a stroke? And they highly suspected it could be a stroke. So be very careful. If it is a stroke, you have to act quickly, because time matters so much if the person is having a stroke. And then, okay, sorry, got distracted there for a moment. So yes, 1, put them in a safe position. 2, contact the nurse. And then 3, take their vitals. So actually, number 2 and 3 can be switched or even done at the same time. So you can be taking their vitals as you're calling the nurse, or you can take the vitals, then call the nurse, because as you're taking the vitals, which is the blood pressure and the oxygen and the heart rate and maybe even blood glucose, if they're diabetic or something you suspect, then do those measures as you're contacting the nurse. So those are all very important, and this was super crazy to see and witness, but very enriching, and wishing the person very well. All right, so talk to you guys later. Bye bye. And if you like this video, please do subscribe and like the video and share with your friends. Comment on what you thought of this video, on if you have ever witnessed someone who was experiencing a stroke in front of your eyes. Oh my gosh, it's crazy. Yeah, so talk to you later. Bye.